In addition to my titles, I am a physician and I'm board certified in anatomic pathology and molecular genetic pathology. In 1989, 25 years ago, I established the Molecular Diagnostics Laboratory at the Brigham and Women's Hospital in Boston. I did so because I and my chairman believed that the nascent understandings of the molecular pathogenesis of disease would transform our healthcare. We would be able to precisely define a disease and thereby provide a patient-specific diagnosis, which would lead to personalized care. Since that time, our knowledge has grown so much. Cancers that we thought were the same and treated the same are now understood as completely distinct at the molecular level. They have different DNA mutations that drive the tumor's growth. So what we originally considered as one lung cancer, for example, an adenocarcinoma, is now 4 distinct lung cancers, each driven by different mutations and each which have its own targeted therapy. Molecular professionals like us define the appropriate treatment plan by pinpointing the driver mutation with our laboratory-developed procedures. We design, optimize, and perform these procedures and interpret and communicate the results drawing on our professional experience, our medical and scientific expertise. This is the practice of medicine. We are not manufacturers. I'd like to highlight that point again. Our practice of medicine is to develop procedures that provide vital information to care for patients in a timely manner. We do that by designing, optimizing, continually optimizing, and performing these procedures, interpreting them and communicating them to our clinicians, relying on our professional and medical and scientific expertise. This is our realm, and we are very proud of it, and we think we do it very well. And let me add another point, is that we develop and implement these procedures at our institutions and do so in concert and in discussion with our clinical physicians so that patient-centric management decisions are met. We don't do this in a vacuum, it's a team effort, and we're all focused on the best care for patients. It's also important to note, because this term clinical validity seems to come up all the time, it's important to note that we, the molecular professionals, do not do research to determine clinical validity. Clinical validity is how well the genetic variant correlates with the disease. That's the definition. Rather, we use our experience and expertise to develop high-quality laboratory procedures to detect the DNA variants that have been well documented in peer-reviewed medical literature to correlate with the disease and significantly impact patient care. We make these decisions in partnership with our clinical colleagues, the treating physicians who request this information to properly treat their patients. Dr. Bossler told you the importance of extended BRAF testing for determining patients who would respond to targeted therapy who had melanoma. Similarly, extended testing for RAS mutation in advanced colon cancer can predict which patients will not respond to expensive targeted therapy, thereby saving costs while improving care. There is no FDA-cleared test for extended RAS testing. As Dr. Bossler alluded to, FDA tests tend to become frozen in time, in part due to the time and expense of completing the requirements imposed on the manufacturers of in vitro diagnostic products. In addition, FDA-cleared tests are also more costly than laboratory-developed procedures. Collectively, Dr. Lyon, Dr. Bossler, and myself have over 50 years of personal and professional dedication to deliver high-quality care for our patients. We design, optimize, perform, and interpret medical laboratory-developed procedures to provide the most current information possible for patient care. We do this under an established, robust regulatory environment. We take responsibility, a weighty one, to deliver the best care. If our laboratories are subjected to the same regulations that the FDA has created for IVD manufacturers, the financial requirements alone, as Dr. Lyon indicated, will drastically restrict and eliminate medically necessary LDPs and jeopardize patient health care and patient access. We're concerned that the draft regulations attempt to regulate all LDPs with a single policy and irreparably harm a very important and useful system in healthcare. We ask the FDA to recognize that what we do is different from manufacturers of IVDs. Rather than a draft guidance, we think that the FDA should follow the appropriate notice and comment rulemaking process to determine the full impact of this wholesale change in oversight and regulation on vital laboratory medical procedures. The Association for Molecular Pathology has thousands of members with expertise in this field and is most willing to work with CMS and FDA to find an appropriate path forward. We hope that the perspectives and information we have shared with you today give you some more insight to the services we provide and what could be lost if we have to abandon or stop improving the procedures we provide. We appreciate that you have come here today and are interested in this very important area of medicine.